So this quick introductory video is all about outcomes, how we use them, if we use them, and our opinions on them. I really think outcome measures are important. I think that it's the way that we can track patient progress. So when we're just progressing a patient through rehab specifically or throughout their treatment, we might not necessarily as clinicians know exactly how they're feeling. Like, hopefully we took a good enough history, hopefully that we are using our best clinical judgment, but are we really doing what's best for the patient? The other reason I think they're really important is to keep the patient motivated. So this past fall, for instance, I had 4 post-surgical patients, and trying to keep them interested in rehab, showing them that they were making improvements, was sometimes a little bit difficult. I think that my view on outcomes is probably a little bit different than everyone else who's going to be taking this class. I have not ever taken this class before, but I've been through a DAT weekend and had friends in the class, so I feel like I know a good amount about the outcomes that were used and previously kind of what some students had learned in this class. I am currently using outcomes. Right now is kind of difficult. We have to use them on pen and paper and then put them into our system. But we just switched to Core AT, which allows you to have outcomes right into it, and it's made it so much easier to keep outcomes. It gives a little reminder of when they're due. The unfortunate part is that as soon as I'm starting to have this and get used to it, I'm leaving down here, and so I'm really excited for the clinical staff here and what they're going to be able to do and use these outcomes. Some barriers and challenges, especially with the paper and pencil method. It was really hard to remember to print them out, to give them to patients, and then you have to scan them and put them into the computer. And so I think that was definitely a barrier within it. When you have an athletic training room with a bunch of people in it, it's sometimes hard to allow the patient some time to think quietly. Even if we have a pretty low ratio of staff to patient work, there's still a good amount of staff members working in a clinic. Another huge barrier, I think, to outcomes is time, and I think that that's a pitiful excuse, but I really think it's true. It's hard when you're getting busy or you're in the mundane of the end of the season to try to remember to do outcomes. I think that's where Core AT is truly a great EMR, because it gives you that reminder. So as you go and you see your patient, you log your daily treatment and rehab and all that, and you're able to see what outcomes need done. And I really think that that's a really good way to take away some of the barriers and challenges that clinicians say they have. I also think that the barrier of time, like I said, is kind of an excuse, because as athletic trainers we say we're so busy, but we are probably, and I think are, doing our patients a disservice if we're not using outcome measures, if we're not using evidence-based practice. I think they're important, like I said, to keep patients motivated, to be able to see progress, to know if our treatment's working. So if we're doing something and our patients aren't perceiving, or if we're not getting quantitative data within strength or range of motion differences, then we need to change up what we're doing as athletic trainers. And I also think it's really important for billing, because being able to see proof of either why they need to continue working with an athletic trainer, physical therapist, whatever, can be shown through outcome measures. So I'm really excited for this class, and kind of an interesting spin, especially now gearing toward education a little bit more, to be able to instill this within my students as a young age and while they're still students, so that way that it's just second nature to them and they don't have a lot of these barriers and challenges that practicing clinicians have.